You've had your C-section. Your incision looks healed on the outside, but inside, it's talking to you. Sometimes it tingles, sometimes it's numb, and sometimes it pulls tight when you reach or laugh. You might wonder, is this normal or is there something wrong? I'm Cherry, a certified maternal and newborn nurse with over 25 years of experience supporting moms through postpartum recovery. If you're a first-time working mom healing from surgery while caring for a newborn, this episode is going to make sense of what you're feeling and give you practical ways to support healing long after the 6-week checkup. Before we dive in, make sure you grab your free resource hub for career moms using the link below. It's completely free and includes all of my nurse-created checklists, workbooks, and recovery guides. Everything you need to make postpartum healing simpler, faster, and less confusing. Let's start with the numbness. When a C-section is performed, several layers are opened: the skin, the fat, the fascia, and the uterus. The small sensory nerves that run through your lower abdomen are cut or stretched in the process. ACOG notes that this kind of temporary nerve injury is expected and can take months to regenerate. That's why the skin above or around your scar often feels numbed, tingly, or somewhat off. For most women, sensation gradually returns between 3 and 12 months. But a small patch of numbness can remain not dangerous, just different. Now, about that itching. As your incision heals, collagen fibers form and the nerve endings start waking up. Those signals can feel like itching or like zapping under the skin. It's one of the best signs of tissue regeneration, even though it's annoying. Keep the area clean and dry. Avoid scratching directly and try gentle pressure with your palm instead. If the itching is accompanied by redness, drainage, or warmth, that's when you should call your doctor to rule out any kind of infection. Otherwise, this is your body knitting itself back together. Then there's the tightness, that feeling that your lower belly is stretched or that you're wearing a band too snug around your scar. That comes from scar adhesion and facial stiffness. The outer scar you can see is only one layer. Deeper tissues can stick together as they heal, limiting mobility and causing that pulling sensation when you stand tall, stretch, or twist. AWHONN and Women's Health PT or physical therapists recommend light scar mobilization once your incision is fully closed and cleared, usually after 6 to 8 weeks. Think small, slow fingertip circles along the scar line. Never forceful. Gentle movement keeps those tissues flexible and reduces long-term discomfort. So, when is tightness not normal? If you experience sharp, burning pain, swelling, or redness, or if the scar appears raised and for months later, consult your doctor or a pelvic floor PT or physical therapist. They can use soft tissue techniques or ultrasound to help release the restriction safely. Left untreated, tight adhesions can sometimes pull on surrounding muscles or even affect posture. Now, let's talk about the healing timeline. In the first 6 weeks, healing focuses on sealing the incision and preventing infection. Numbness and itching dominate this phase. Between 6 and 12 weeks, tissues begin to remodel, and tightness shows up more as you become active again. From 3 to 6 months, your scar matures, the color fades, the tissue softens, and most sensations begin to normalize. By a year, your incision is typically strong, though a bit of numbness or sensitivity can linger. Everyone heals differently, depending on nutrition, movement, stress, and genetics, which is why comparison doesn't really help. Speaking of nutrition and stress, your daily habits make a huge difference. Protein, Vitamin C, zinc, and hydration all help collagen form properly. Chronic stress, caffeine, overload, and poor sleep slow it down. That's why inside my free resource hub for career moms, you'll find practical tools to make this easier. From a postpartum plate builder and recovery checklist to quick mobility ideas you can do during the workday. It's all nurse designed for busy moms who don't have hours to figure things out on their own. Let's clear up a common fear. Will this weird feeling ever go away? For most moms, yes. Sensation improves steadily. Your nerves regrow at about 1 millimeter per day. So recovery is slow, but steady. If you ever feel shooting pain, burning, or pins and needles that worsen over time, that's when a doctor should evaluate. Persistent hypersensitivity can be treated with desensitization techniques or gentle massage. No need to just live with it. Now, before we wrap up, let's acknowledge something bigger. C-section recovery doesn't end at the scar line. The tugging, numbness, and tightness you feel are reminders that your body is still doing deep, complex repair. It's rebuilding strength layer by layer while you're managing work, feedings, and everything else that life demands. Healing is not weakness. It's active, ongoing work. That's why patience matters so much. Give your body the time it needs and meet each day as it is, not as you wish it looked. Healing is not linear, but it is happening. For your next step, watch this video right here. It'll show you how to move comfortably again while protecting your incision and your core. Before you go, I want you to hear these. Recovery takes time, and the small progress you don't notice today will add up to the strength you can feel months from now. Give yourself credit for showing up, for learning, and for caring enough to heal. If this video brought you clarity or comfort, please like and subscribe. It tells YouTube to keep showing you nurse-backed postpartum guidance that respects your body and your time. You deserve recovery that feels informed, realistic, and supported. I'm Cherry, and I will see you in the next one.